Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedics, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and welcome to The Moving Body. Welcome back if you've been listening to the earlier show. Today is August 30th, 2014. Thank you for that, Harry, because I'm always going to say that because of my fan and friend Harry. And so this is the penultimate day of August, and we're into September on Monday, a holiday, 3-day weekend here. Woo! Very happy about that. Sorry I wasn't doing the show live last week. I try, if I'm in town, I always try to make the show no matter what, unless I'm sick or hoarse or have something compelling to go to. And last week there was something compelling. I was a participant in Duke's Ocean Fest Classic Legend Surf Contest. And it was a blast. And we were in a heat first thing Saturday morning, so I couldn't possibly come. So I hope you enjoyed the replay. And I hope the replay wasn't a replay of the first replay, because there's nothing quite worse than a replay of a replay. But it happens. And it sure is nice to be out at Queens with only 5 guys, all of whom are pretty good surfers except yours truly, which I'm a medium fair, less than fair surfer. But we had fun, and it was great waves. And it was a great cause, so we donated to the Duke Foundation. But that's where I was, and now we are live. So the number here, 521-8383. If you're listening from a neighbor island, you can call 1-888-565-8383, and we'll take your call. Later on in the show, the lines are sometimes full, and it's hard to get through. So if you have a question for me regarding your back pain or sciatica or neck pain or shoulder pain or numbness in your hand or hip pain or any sort of orthopedic question, sports medicine question, health and fitness question, exercise, give me a call, 521-8383. Well, let's get down to it. Not only was I involved in the Duke's Ocean Fest Surf Contest last week, but my office moved. And most of you who listen to the show are aware of this. I was on Pi'ikoi Street for the last umpteen years, 28 to be exact, and decided to move downtown to Bishop. And it was fraught with a lot of anxiety and trepidation and fear on the part of my patients, staff, and even myself, frankly, because a lot of people don't like going downtown, and the traffic is intense, and a lot of one-way streets, and there's no place to park, and a lot of people just avoid it. But it turns out that it's just been great. We moved successfully. We had to close 2 Fridays ago, pack up, move over the weekend, Monday, Tuesday, unpack and set up. We saw patients a week ago Wednesday, Thursday, Friday, had last weekend off. That's when I surfed. And then all this past week, we've been seeing patients, and things have been going really smooth, and I'm really relieved. And patients have been very understanding and receptive, and the parking is great, and the traffic's not bad, and the office is drop-dead gorgeous. I say this in all humility, but I've never seen a nicer doctor's office, and I go there feeling, is this really my place? Am I worthy of this? Almost embarrassing how beautiful it is, but it's spacious and allows us to provide care and service that we just couldn't do in our old office. I can say more about that in a minute, but let me take my first caller of the morning, Rodney. Rodney, go ahead. You're on the air, and thanks for calling.
Yes, Dr. Portner. My wife has plantar fasciitis.
Yes.
And her podiatrist and even her doctor says that sometimes it lasts a long time.
Yes.
Why is it so hard to cure?
Well, first of all, I don't assume that I agree with that. I've had very good success with plantar fasciitis. some conditions in the orthopedic realm are difficult to fix, and cure is also a difficult term. You know, we can cure, you know, pneumonia, but curing orthopedic problems is sometimes more challenging. But why is it so hard to get rid of this is a question I can't answer, and it's not always difficult. What has been tried so far?
She's done some exercises, stretching exercises.
Yes.
Putting ice.
Okay.
And when she first went to the doctor, she told him the pain was so bad that she wanted an injection, so she gave her an injection.
And did the injection work?
Just for, you know, one or 2 weeks. And that's it.
Did she try any of these splints, these night splints?
Yeah, she has a splint.
Does that help?
It helps, but for some reason she doesn't like to wear it at night because she sweats and it's hot. It's uncomfortable.
Yeah. And they do make other kind, and you can, if you're a Google kind of guy,
yes,
you can go or go to Amazon and just type in brace or plantar fasciitis.
Uh-huh.
They make them that are just very not elaborate, just with straps, and it does the same thing. So I'm not a big fan of bracing for plantar fasciitis, but the truth is it does sometimes help. Now, this injection that she had, was this done with ultrasound needle guidance, or did the doctor just whip out a syringe right in the office and gave her a shot right then and there?
I think he just gave her a shot.
Yeah. So, in my experience, and that's the only experience I can really talk about, that plantar fasciitis is generally not difficult to treat. That when physical therapy and friction massage, did she ever have any friction massage?
No.
Yeah. So, it's difficult to treat if you don't try all the reasonable treatments. But it's sometimes that's the fault of the doctor more than the difficulty of the lesion, if you know what I mean. It's not that challenging usually. Now, I do have to admit that I've come across in my day difficult cases, but in your wife's case, what's made it difficult is that perhaps she just hasn't been given the right treatment.
I see.
And sometimes the failure to treat properly is the culprit, not the fact that it's just a difficult lesion. So the treatment for plantar fasciitis is number one and foremost to make sure it is a plantar fasciitis. Not all heel pain is due to plantar fasciitis. Sometimes it's a stress fracture. Sometimes it's a tendinitis. Sometimes it's a referred pain into the foot from someplace else. So number one is be sure of the diagnosis. Number two, if you are sure of the diagnosis, make sure you try proper physical therapy. And that includes what's actually termed fascial release. But in any case, it's a manual therapy, a type of massage, as well as stretching and so on. And we also use oral pills, anti-inflammatories. And then if all of these things fail, the therapy, the brace, the pills, if all of that fails, then we try an injection. Nowadays, we give our injections under ultrasound needle guidance, using the ultrasound machine, just like the one they use, the obstetricians use to determine the sex of the developing baby inside. We use that to make sure that the needle is right in the lesion, right in the fascia. And we give it in a certain technique where we pepper it with 20 little droplets rather than one big what we call bolus, one big glob of medicine. So not all shots are the same, and that's cortisone. And that can be done repeatedly. You don't have to worry about just doing it once, or you can only do it a couple times. It's a fascia that can take several injections. And then that has to be coupled with stretching exercises. And then if that fails, there are still a couple of treatments a little bit newer where we use what's called PRP. It's a platelet-rich plasma. And I brought this technique to Hawaii. I'm not sure who else is doing it. Maybe somebody up at Tripler might be doing it and a couple others by now. But there's certain factors that circulate in your blood that help with healing and collagen growth and inflammation. And if we draw out some blood from the patient, spin it down in a centrifuge so it layers out into its various layers, and carefully siphon off the layer that is rich in platelets. These are little pieces of cells that help with clotting, actually.
Mm-hmm.
But in that layer, there are several factors that help with inflammation and healing, and we inject that into the fascia where the cortisone didn't do the trick. And sometimes that is very effective. So I have a story to tell about PRP later on in the show. But that's what I have to say. In summary, what I have to say is this. There's still room for optimism, and it doesn't have to last a long time.
Mm-hmm.
And there should be, at this point, an X-ray or a bone scan to make sure that that's the proper diagnosis.
Mm-hmm.
And there's some physical therapeutics that your wife has not yet been offered that are worth trying.
Okay.
And you can do this shot several times, and it's better done under ultrasound needle guidance. And if that doesn't work, we try the PRP. Now, if all else fails and the patient is miserable and they get up every morning and they can't hardly hobble to the bathroom without a great deal of difficulty, then there is a surgical procedure that's available and quite simple and predictably effective where the fascia is actually released off of the heel bone. So it's cut off. So if it's cut off, it can no longer pull and hurt. And that's a last ditch effort. And rarely in my career of over 30 years, I can count on one hand the number of times I've had to order that.
Okay.
So plenty of room for improvement over there. It's not time to give up. You can ask the doctor for another shot. You're welcome to come to our new office and see if I can inject it, or maybe better yet, ask my therapist to treat it a little bit more aggressively.
Okay.
And if that doesn't work, then we can break out the old ultrasound machine and guide the needle right, exactly, precisely into where the fascia is microscopically tearing off of the bone.
Okay, and then also, what about foot inserts?
Right. So foot inserts don't have much of a role. I mean, sometimes lifting up the heel a little bit can put some slack into the fascia and help. But I think that the role of inserts is overrated. And I'm not saying they're totally useless, but that's not the answer for someone who's suffering with so much and such a long history of pain. How long has your wife had this fasciitis?
For months.
For months, yeah. It's not likely to do the trick.
Okay.
Make sure the diagnosis, get the manual massage therapy, try a couple more injections under ultrasound, and that should do the trick. If not, look into PRP, and I doubt if surgery is going to be necessary.
Yeah, I wouldn't want that. Yeah.
Right.
Where's your new office located again?
It's over on Bishop Street, 1132 Bishop Street. It's just Mackay of Beretania, about half a block.
Okay.
Yeah. And it's the same number as always. So you call and you'll leave a message. I don't think anyone's there to answer. Oh, maybe. You can call until noon. But in any case, you could leave a message and we'll call you on Monday.
Okay, thank you.
All right. Thanks for the call, Rodney.
I appreciate it. Bye.
Take care. Bye-bye. You're listening to Dr. Bernie Portner. Hope you're enjoying the show. The number here, 521-8383. Give me a call. if you have any questions regarding arm, leg, neck, or back, be happy to take your call and try to answer it. If you're listening from a neighbor island, you can call toll-free at 1-888-565-8383. The number at the office is still 596-7300. We're open today in Kaneohe with Dr. Fernandez, and he's working there. I'm not sure if he has any room for patients today. He's usually booked on Saturday. But you can give it a try, 596-7300. Both clinics use the same phone number. What an ordeal that move was. We had to, I don't even want to go through it right now. It gives me a headache. But there were a lot of things to take care of. And I have to hand it to Tony, my business executive guy, who took care of the whole move. He took care of the whole project, actually. But the move was especially complicated with many weak links. And he took care of the whole shebang. And it worked out well. The first day that I saw patients 2 Wednesdays ago, we were quite busy because, of course, we were backlogged. There were 3 days that we didn't see patients. And it was easier than it was and smoother than it was over at my old office where things were getting cramped. And there just wasn't enough room. Okay, 521-8383. Let me take my next caller. Go ahead, Roy. You're on the air, and thanks for calling.
Hey, Dr. Potter.
Yes.
I finally got to see a physiatrist.
Were you
Hawaii.
happy? Were you satisfied? Were you impressed, or not so much?
Well, this is what she diagnosed me with. She said I have arthritis in my back, but she didn't really tell me really what the problem. So I finally had to call back. They say it's like stenosis.
Yes, because it hurts when you stand and it's not so bad when you sit.
Yeah, but even when I sit, it hurts too, though. Stenosis can do that too?
Typically, stenosis is relieved with sitting, and it hurts with standing. And as soon as you sit down, it feels better.
Well, it feels bad, but sitting time, it hurts.
It feels better, but it doesn't go away.
I go the way after a while, but I gotta move around like freaking week.
And what does she suggest you do about this arthritis stenosis?
I told her, I've been suffering already 2 months, right? Yeah. Finally, I told her I was taking anti-inflammatories. I don't think I want to take that too long. So I told her maybe I need a epidural, yeah?
Yeah.
Okay. But the question is, I have to wait till October. Because they used to do it at the hospital where I go. There's a doctor named Grigsby. He comes from California. Every month he comes for 1 week a month, and he's a pain specialist. So I was referred to him.
Every time I hear you call me, and every time I hear this situation on Kauai, I want to get a plane ticket and come out there once a week and do a job.
That's right, because they hiring a guy from California to come over and spend a week.
Who hires him? The hospital?
Oh, well, actually, he's on I don't know how it works. Yeah. He's a private, I guess he has his own practice in California. And I heard he's supposed to be real renowned. Eh? Do you ever heard of him?
What's his name?
Alan Greensby.
No.
From California, where they had that earthquake. That's, the one they had last week, right. But he didn't suffer any damages, so he comes. I have to go and talk to him for consultation, to make an appointment.
First the consultation, and then he'll see if he'll inject you?
Yeah, I don't know how that's what I guess I was told. That's why I told him, I told the doctor, this physiatrist, so I she doesn't want to talk too much, so I finally had to talk to her nurse. I said, how come I got to wait till October? I was shocked. So then I said, what about if I go to Oahu? Yeah. Can you guys refer me to that? They said, you got to wait just as long too. Is that true?
No, I can do it this week.
Oh, yeah. Maybe.
Yeah, I always make room for people in pain. That we just stay later or do it during lunch. I wouldn't make you suffer a month. So that
if I was tell her, if I was to say I want to be seen by Dr. Porter, I don't know who they refer, because there's different doctors. I don't know who they go to, yeah?
Are you in Kaiser or something?
No, I'm Medicare and HMSA.
You don't need no stinking referral. You can just call my office, make an appointment.
And what I need to bring? My x-ray?
Yeah, bring what you got. It'll take 2 days. I'll have to examine you on the first day and make sure that I agree with the diagnosis and the treatment. And then, if so, I would do the shot on the second day.
Oh, I would have to stay 2 days then.
Yeah. Well, 1 night. Well, yeah, 1 night, 2 days.
See, that's why I was hoping, but the only problem I told them, what about my plane fare? Would they reimburse me? They said if it's referred, see, that's a key. If they refer you, I don't know how Medicare works or HMSA. They part of your plane fare, I was told, but I have to be referred by the doctor though.
In order to get the plane fare?
Yeah, to get coverage for part of my travel. Yeah, the plane
then
fare.
tell them to refer you. But I don't need the referral. I can see you without it. But if the referral gets you a plane ticket, just ask them to refer you.
Yeah, I don't know if she heard of you.
She's heard of me. She's heard of me.
Oh yeah, she referred patients to you already?
I don't know, but I've been in the state for 30-some years. I'm sure she's heard of me.
Yeah, I keep telling. Well, I didn't mention your name, but
yeah, go ahead. If that's what it takes to get reimbursed for your plane fare, do it.
Yeah,
do it. I'm happy to see you.
Yeah, that's why I was hoping if you probably should come. If they have to bring somebody from California, maybe
where
you should come over there. Huh?
Where does this guy do the shot? At the hospital?
Yeah, but his clinic is in. You ever heard of Kaneohe, Hawaii?
Where is it?
Down at Poipu. Okay, Poipu side.
Yes.
Poipu. Well, he lives. I would have to go down there. I live on the north shore of Kauai. I would have to drive almost like 15, 20 miles just to go consult with him.
So why don't you just drive to Lihue and get on a plane?
That's another thing. And then the question is, stenosis, okay, that's not a solution, epidural. Like now I'm taking gabapentin.
Okay, so let me talk about stenosis and epidurals. It's not a cure. That even if it works, even when it works, which is often the case, it doesn't necessarily work for a long time. It might work very well for several months. It might not work at all, and everything in between. But it's not a permanent solution. So you should know that. Even if you get the plane ticket, get the referral, get the plane ticket, come and see me, get the shot, and it works, it doesn't mean that a year from now you're not going to have stenosis anymore. The answer to bad stenosis after several treatments and several shots and the patient still can't stand and walk is a surgical solution where they open up the narrowing. Stenosis means narrowing. Where they open up the narrowing and allow the nerves to breathe. So you're welcome to come to Honolulu. We can make time for you, but and you're welcome to try to get a referral. I don't see why she wouldn't. And if you've never heard of me, just tell her to Google me or go to my website, PortnerOrthopedic.com, and I'm sure she would be happy to send you. No.
Okay, I have to go call them up because so far, I called that office and they...
If you're going to have a shot to help with pain, you shouldn't have to wait so long.
And in the meantime, I'm taking that Meloxicam. How long should you take that? That's an anti-inflammatory. How long does a patient supposed to take that? Not more than 2 months?
Meloxicam can be taken long term, but it's not the answer. And also remember this, if you do come to Honolulu for the shot, you want to stay off the Meloxicam for several days because I can't give you the shot if you're taking Meloxicam. Or aspirin, or Motrin, or Aleve, or Advil, or Lodine. Or any of those, okay?
Well, right now I'm not. I stopped taking that because they said if it's not working, it don't make sense taking it
doesn't
anymore.
make sense.
So they gave me gabapentin.
Right. Okay,
I'm
Roy,
on that now.
listen, do this. See if you can get the referral. Bring your
Okay.
MRI or X-rays, and we'll see you.
Okay.
All right.
And can that be combination of IT band and stenosis? Can that
Well,
be
you could have both. There's no
both?
law against it. People
Oh.
can have as many problems as they want.
Okay.
All right.
Well, hopefully. Okay. I get hard time really get to her too. Okay.
All right.
Okay. I'll
Thanks
talk
for
to
the
you
call,
later.
Roy.
Thank you.
Take care. Feel good.
Yeah.
You're listening to Dr. Bernie Portner. The number here, 521-8383. Give me a call if you have any questions regarding arm, leg, neck, or back pain. We got another half hour in this show, or maybe 25 minutes. Darlene, go ahead. You're on the air, and thanks for calling.
I actually have two questions. One, I have limitation of movement of my left arm. For instance, I can't reach back to get the seat belt. I can't put my hand on my hip. I can't move it back at all. It's been probably about 10 weeks now. Hasn't gotten any worse, I don't think, but it hasn't gotten any better. But it hurts kind of way up high in the muscle. Way up high on my arm. And I have friends who, have had to have surgery on their shoulders, but I don't know if my pain indicates that kind of thing.
No, stop it with the surgery. It's no time to talk about surgery. Almost every condition in the shoulder, whether it's a tendinitis or bursitis or capsulitis or arthritis, hurts in the same place, deep in that muscle, that deltoid muscle. So the location of the pain is not really that informative. It all hurts in the same place. There's just rare exception. And shoulder pain is one of my favorite areas because it's so easy to examine, right? The shoulder is out there. So you can touch the top, you can touch the side, you can touch the back, you can touch the front, you can touch the bottom under the armpit. You can really get at it. And most of the time, shoulder pain is very gratifying for me to treat and satisfying for the patient because we can relieve it. I wouldn't even think about surgery, not for a long, long time. You need a diagnosis, first of all, a proper diagnosis, one that comes only with a careful exam. And unfortunately, not everybody knows has been trained to do that exam. So get a proper diagnosis. You're not calling from Kauai also, are you?
No, I'm on Oahu.
Yeah. So maybe come in and see us or have your doctor send you to his favorite orthopedic specialist, whatever, and get diagnosed. And then we can treat you usually conservatively.
Yeah, I was thinking I probably need physical therapy.
Yeah.
Just mentioned friends having had surgery.
Right.
Well, now, do you accept the Humana Advantage?
That I don't know offhand. We take most insurance companies, but I can't say for sure about that.
Okay.
I don't want to say. There are a few exceptions where we don't accept certain insurance companies, but I honestly don't remember the list of ones we take and ones we don't take. When you call the office, that could be your first question.
What is the number?
596-7300.
7300. Okay.
Yeah.
My second question, I have two bad knees, and I would rather not have the surgery, even though they have a high success rate. I tried stem cell on the one, and it certainly has improved it. I haven't seen it on X-ray, but symptomatically it's better.
Where did you get the stem cell?
Well, I was in Florida at the time. A Dr. Purita, who has been doing it
Where
for about...
did he get the stem cells?
Oh, from me.
What part of you?
From my pelvic bone and from the blood, and then it followed up with PRPs.
Was it painful, the from the hip, the bone marrow?
Not terribly. The greatest pain was injecting 7 syringes full of fluid back into my knee until the fluid distributed in all the spaces. But
and how many times was that done?
Only once.
It was a one-time deal.
Except for the follow-up PRPs.
And how many PRPs did you have?
He usually does 2 as part of the protocol. That's covered in the expense, and I opted to have a 3rd one.
And this was out of pocket, I imagine.
It is, yeah.
Not yet covered by most insurance companies. Although I have had a couple of insurance companies approve PRP. I'm just studying stem cells now, and hope to start offering stem cells. I'm going to be trying first getting stem cells from fatty tissue because it's a little bit less painful and a little bit less a chance of infection. But it's very interesting what you say. But yet you're making this call. So just how successful was this out-of-pocket expense that you?
Well, I think quite successful. I'm walking normally. I have after like 9 weeks, I had no pain anymore.
Mm-hmm. And this was on both knees, or
no. That's why I'm now. I don't know about the other knee. I don't want to go through. I was scheduled for a total knee on the one that and 10 days before I broke my hip. And I had some problems with the hip, so I said, if I can do without surgery, I'm going to try. So I bit the bullet and then had the stem cell. I'm not unhappy with it. But now my other knee needs doing, and I have heard of Makoplasty, which can that be for a total knee, or is that a partial knee?
I think, I'm not a surgeon, but it's my understanding that that's a partial knee replacement, usually the medial compartment. And I'd have to look that up. But first of all, if you had good success with non-surgical treatment on one knee, why not do the same non-surgical treatment on the opposite rather than have a total knee replacement?
Well, because of the expense, and it's not covered at all. It was $6,000 plus a whole year of medications that I don't ordinarily take. So
what about trying just the PRP portion?
I hadn't thought about that,
because I've had some success with just doing the PRP.
But it doesn't build up cartilage like the stem cells do, does it? It just takes down inflammation.
No, actually, as the theory goes, this is not solid science yet, but PRP can in fact help with healing. That's the idea. So, I don't know. I understand what you're coming from, that, it's more expensive because, the operation is way more expensive, but not out of your pocket.
Exactly. Oh, yeah.
And also the time, when you have a total knee or even a partial knee replacement, it's still many months of post-operative rehabilitation and recovery.
And yet the Makoplasty is, you come home the next morning and the recovery is much faster.
That's what I'm told, yeah.
Yeah, and I don't understand how it could be that different, because you're still opening up the knee, you're still putting in a false part.
Right. And there's also another option that how old are you, by the way?
77.
There's another option that we're looking into, and that's doing what's called a nerve block and then an ablation. Just like we do in the back, we can identify the nerve that comes from that portion of your arthritic knee and sends pain signals to your brain, and we can interrupt that. And it doesn't cure anything, but nothing cures this. And we can block the pain, and you can get a few more years out of it. Because at 77 nowadays, you might live another 20 years. Who knows? And in which case, you might your brand new knee might be might need redoing. So you could also look into the nerve ablation option, and you could at least try the PRP because it's way less expensive. It's not thousands of dollars; it's a few hundred.
Yeah, it was $100 each one.
Yeah, so I do that. It's not $100. My kit costs $250. So anyway, you might look into that. And
it may have been 100 because it was partially covered by
right.
the insurance.
Oh, was it?
I'm saying it. Perhaps that's why,
No,
or perhaps it's because I was part of the program for the stem cell. I don't know which.
I'm sure that's what it was. That it was part of the overall package because the guy charged you $6,000. It's quite a bit of money out of your pocket.
Mm-hmm. And well, that included 2 PRPs, and then I had to pay $100 for the third one. So he may have given me a break because I did all the other.
I think so.
Okay, well, I will call the office about
we can at least talk about
the shoulder.
And we can certainly see the shoulder. And if you want, you can tell them you'd like to talk about your knee also. They'll give you another couple of time slots so we have the time to talk about both.
Okay. Thank you so much.
Okay.
Bye-bye.
Thanks for the call. You're listening to Dr. Bernie Portner. The number here, 521-8383. Give me a call if you have any questions regarding arm, leg, neck, or back pain. We have another, 15, 20 minutes to go before the end of the show. Let me see if I can get this. I'm trying to work the computer, but can't do it. Anyway, Kauai, it's intriguing. I'm still thinking about my call from Roy on Kauai. I have a doctor, Dr. David Bro, who started with me. It's been a couple months already now. He moved most of you know this, he moved his whole family, lock, stock, barrel, and Doberman Pinscher, or Great Dane, with him to work with me. And he listens to the show. Dave, hello. I know you're listening out there. And during the show, he's texting me all kinds of comments. And it's hard to read and to listen and to focus at the same time. But he, too, is amazed about this Kauai business. On how he says it's like a third world country over there. They got to fly in doctors. And he's chomping at the bit. We're seriously considering maybe doing something about that. I don't know. If we can provide services, at least part-time, to our fellow citizens on Kauai. So we'll see about that. Here, he texted me again here. Oh, right. Visco supplementation. You see, he's cueing the old doc because I forget things. I don't know. In our last caller, we didn't exactly talk about Hyalga and Synvisc, but if you're still listening, think about that. We can do this artificial lubrication just to buy time. Let's see. I have another caller here. Is it Sally? Sally, go ahead. You're on the air, and thanks for calling.
Hey, thank you. I've been a bad girl.
Oopsies. Wait, this is a family show now, so...
I only do family things at this point, but...
Okay, good. I was just saying. What's up? What were you bad about? You overdid it, I suppose.
Well, I re-injured my collateral medial tendon, and so I was just wondering, I was overstretching in yoga, so I know it's a dumb question, but should I just not sit Indian style? And
now, just a second. You mentioned a certain thing that you injured, a lateral medial tendon. I'm not sure what that is. You mean
a
collateral ligament, maybe, of your knee?
Yeah.
And is it the lateral or the medial?
Medial.
On the inside?
Yes.
And you got it doing yoga, sitting...
No, I originally got it from setting a ball in volleyball. I was diving.
I see, you were diving, digging out a ball to set it.
Yeah, and I hit that medial portion.
How long ago was that?
Oh, that was not this last Easter, but the Easter before. And then it healed, and then I do kind of extreme stretching, and I just kind of overdid it on the stretching. I thought it was all done, but it kind of kicked back up. And I've been doing a lot of office work, sitting Indian style on the floor, because I hate sitting at a desk.
And does it hurt when you sit like that?
Well, it started to, yeah, so
you'll avoid that. And who do you see for this? Do you see any doctor over there to get this?
Nah, not really.
Well, you've had it for a long time, and I think it'd be a good idea to get this properly diagnosed. First of all, make sure that's what it is, and that's all it is. Sometimes more than one thing is causing knee pain. And then the other thing you want to do is, after you get it properly diagnosed, try some treatment, try some therapy, try some, depending on what it is, friction massage, try an injection. You know, you don't necessarily have to live with this. In the meantime, you do have to live with it because you have it and you're living. So avoid those things like Indian sitting. Avoid those things that you know bother you. But don't just tough it out. Come on.
Well, that's kind of like what I do. I just tough everything out. I get so many injuries that I just tough it out. That's my tough thing, you know.
Yeah, well, sometimes you got to be tough and take care of it. That's sometimes the tough thing to do is to actually take care of something rather than
or actually rest it
or let it heal. Yeah, but you're on Maui. You can always be in the water and let it heal. It's not going to get hurt in the water, and you could be
that's
active
true.
and exercise, not necessarily surfing, but at least swimming. And
I had a lot of office work to do, so I had to
well, you can do
curtail
office
all
work sitting.
activities.
You can do it standing. You don't have to do it cross-legged sitting.
I could probably move my paperwork to the kitchen and work high and stand.
Yeah, there you go.
Yeah. And the injections would be the first one, not cortisone or cortisone.
I don't know what your diagnosis really is. If it's a ligament, like you say it is,
yes,
and nothing else, it would, unless you're really dead set against cortisone, that would be my first injection try, although I might try other treatments before an injection. There is
the friction.
The friction can be very, very useful. And but if I was to end up giving this a shot, it would probably be a cortisone shot right off the bat as my first attempt. The exceptions to that is if somebody doesn't tolerate cortisone, or if somebody has some sort of philosophical a bias against cortisone, and then we can move straight to the PRP.
You would bypass Halogen and Synvis?
Well, that's for a different diagnosis. That's why I was trying to tell you, Sally. That's for osteoarthritis. So if you have that would be different, but that doesn't help anything but osteoarthritis.
Oh, okay.
It's not good.
Well, good.
So,
well, thanks very much.
I'm dying to meet you one of these days. You're just going to have to break down, get on a plane, and let me come over here and let me fix you.
Okay.
That's what we'll have
I'll probably
to do.
have the whole new things wrong with me.
Yeah, it's always changing with you.
But you know what's really good is that the new one takes my mind off the old one, and then
I'll tell you what's really good is the new one prompts you to call me again. That way I get a call.
And it's so cool to get an old one that comes back instead of a new one, but an old new one.
I'd rather have a new one.
Okay.
Well, keep these calls coming. I appreciate it. Enjoy talking to you.
Well, thank you. Aloha.
Behave yourself now. Bye-bye.
I try.
Let's see. 521-8383. We still have another 5 or 10 minutes, so I'll be happy to give you a call. I wanted to share with you a story about a patient from Kauai. It seems to be a theme today, is Kauai and the outer islands. But I have a patient who, I think he heard me on this radio show. In any case, he came to me, flew over from Kauai with a 3-year history of elbow pain due to tennis elbow. And he had tried a bunch of things and was miserable and at his wit's end. And finally, long story short, finally we decided to go ahead with the a PRP injection. And sure enough, I just saw him, I think yesterday or Thursday, and he's like 80% better, feels the best he's felt in 3 or 4 years since it started. And it's very chicken skin kind of gratifying to hear that I did some good. So that's what we can do sometimes when we know the right diagnosis and we try the right treatment and we perform it correctly, using needle guidance. That's really key. And there he is, 80% better, and we're not done. I'm going to try to make him better still. And that's with the PRP. I haven't even started with the stem cells, which I'm very excited about, that we're going to be doing stem cells. So that's when things go well. Now, it wouldn't be fair to just tell you the good stories. I also have had my failures. I have another patient that comes to mind, again with a tennis elbow, or what's called golfer's elbow, same thing on the other side of the elbow. And this guy also had it bad, and nothing worked, and we ended up trying PRP, and that too, I'm sorry, that did work on one elbow. He had two elbows. It worked on one side, but not the other, if I'm not mistaken. And now I sent him to a surgeon because I do that. People who hear this show think I'm against surgery. On the contrary, I'm all for surgery, but only when appropriate, and only when all reasonable and safe non-surgical treatments have been tried and exhausted. And when I say reasonable, I'm talking about have a reasonable chance of helping. I'm not talking about magnets here, which are safe, but not reasonable. Anyway, this guy is going to surgery, so that I'm just giving equal time here. That I have cases of PRP that are apparently miraculously helpful, and then I have cases of PRP that fail, and both are true. There's no guarantees and there's no miracles here. This is sometimes it works and sometimes it doesn't. And we always try our best. That's all. Like I say, there's just another 5 minutes or so. I see I have another caller, Jim. Jim, you're calling from downtown. That's my new neck of the woods.
Yes, I know.
You're
Thanks,
on the
Dr.
air.
Ford.
What's up?
Had a question. After a diagnosis of supraspinatus tendinitis
Yes.
and treatment, what with icing and physical therapy and so forth, what would the expectation be? I guess they're all different, but about how long should the soreness go away, or the inflammation go away? Do you have any?
Okay, so I don't want to belabor this, but let me answer it this way.
Mm-hmm.
Let's assume that the diagnosis is correct, first of all, which is it sometimes is and it sometimes isn't. Was the diagnosis made because the MRI showed a supraspinatus tendinitis?
No, I never had an MRI.
So it was a diagnosis made by physical exam?
Yes, sir.
Okay, so for the purposes of the rest of this conversation, we'll assume that the diagnosis is accurate, which is kind of a big leap, but okay. So you have a supraspinatus tendinitis, and you've had it for how long now?
Oh, a couple months.
And what kind of work you do?
I'm retired.
That kind of work. And how do you spend your time?
Oh, I have tons of activities.
Strenuous physical activities?
Well, until this happened, yeah, I did fairly strenuous.
What were you doing?
I would do Zumba and yoga and going to the beach and doing some paddleboarding and,
I notice how when you talk to me or when you talk to a physiatrist about a certain condition, I don't know if you listen to the show much, but I'm always getting into your business. I'm always trying to find out what do you do, because it makes a huge difference in terms of not only understanding the condition, but understanding what's at stake and what the healed shoulder has to put up with again, what the goal is. The goal is to do more paddling one day, not to mention all these other Zumba-like activities. So that's important. Now, when you go to physical therapy, some of it is kind of a waste of time. Sometimes they just put heat on it. Sometimes they just put electrical stimulation on it. Sometimes they just use ultrasound. Sometimes they do friction massage, which is, I think, a very good treatment for this. Have you had any of that, friction massage?
No, I've had some. I have about 4 exercises I do after which I ice.
Right. So I think it's fair to say that you probably haven't exhausted all possible non-surgical treatments, at least not in the physical therapy world. And then if all of that fails and you get the proper therapy and rest and friction massage and do the exercises, then if that's still bothering you, a cortisone injection is almost predictably effective.
I see. Okay.
That too has to be, that too has to be done quite carefully. And under ultrasound so you can get it right in the right place. But the answer to your question is that it's going to last until one, you arrest it and it heals on its own, or 2, until you get the proper treatment. And by proper, I mean effective.
You really have to have, I mean, you mentioned a proper diagnosis. It sounds like an MRI, besides just a physical exam.
No, I don't mean to sound that way. The physical exam is all that it usually takes.
Okay.
We resort to the MRI when the diagnosis is not clear, or when we're going to refer the patient to a surgeon because nothing's helped, and the surgeon is going to want to see it. So an MRI is not mandatory for a proper diagnosis. Not always.
But the tendinitis means there is an inflammation of the tendon.
Correct. Literally, that's what it means.
Yeah.
And what that means is that usually on a microscopic level, the fibers, the collagen fibers, are torn. Some of them are torn off of the bone usually. Right.
Okay.
So, listen, Jim, I gotta go. They're
understood.
Gonna cut me off in about 10
Thanks
seconds.
so much, Doc.
Thanks for the call.
You bet. Bye.
Bye-bye. That's about everybody. Remember, we've moved downtown. It went really well. A big hug of gratitude to Tony for helping me do this, and to all my patients who put up with the change. Change is never easy. In the meantime, go out there, have some fun, and we'll see you next week. Take care. Bye, everybody. Thank you for listening to The Moving Body. Hope you enjoyed the show. Remember, if you're having problems with your arms, leg, neck, or back, and would like to get an appointment over at the office on Pe'ikoi Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray is normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendinitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time, on KHVH. Go out there and exercise this weekend. It's the single most important thing you can do for your health and body. Health cannot be bought off the shelf. Special nutritional supplements is not what it's going to take to improve your health. It's going to take a lifestyle change. It's going to take for you to put on some good water.